Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Tuesday, June the 2nd. Last night, our latest series of regional health virtual town halls concluded, with Interior Health welcoming a viewing audience of 9,500 people. MLAs Katrina Conroy and Doug Klofchuk hosted a fast-paced and informative virtual gathering. 34 submitted and live questions were asked and answered of guests. Interior Health CEO Susan Brown and Chief Medical Health Officer Dr. Sue Pollack did a great job providing helpful, informative answers, and we thank everyone who took part with questions, of course, the hosts and the guests for doing that. We're honored to be here on the territory of Lekwungen-speaking people of the Songhees, the Esquimalt First Nations. I'll remind you that tomorrow, Wednesday, we'll be providing a written briefing on case counts and other issues at around 3 o'clock. On Thursday at 3 o'clock, Dr. Henry and I will be giving a briefing at that time. Dr. Henry will be updating some issues around modeling and other things of interest with respect to the pandemic in British Columbia. I'll be providing an update on the single site order and on surgeries. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, we have 4 new additional cases of people who have tested positive for COVID-19, bringing our total in British Columbia to 2,601 people who have tested positive. And that includes 904 people in the Vancouver Coastal Health Region, so no increase there today, 1,311 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 195 people in the Interior Health Region, and 64 people in the Northern Health Region. We have no new healthcare outbreaks, and I'm very pleased to say we have a number that have been declared over in the last 24 hours, including, very importantly, the Abbotsford Regional Hospital ICU outbreak, where 10 healthcare workers were infected and affected, including 2 who ended up in our intensive care unit. And I'm just extremely pleased to be able to say that both of them were discharged home, and grateful for the care that they received, and for the whole team in Fraser Health and at Abbotsford who weathered that storm and cared for each other through it. As well, the outbreaks at Amica Edgemont and Royal Arch Masonic Home, Chartwell Willow, and Eden Care Centre have been declared over with no new cases for the last 28 days. We remain with 8 active outbreaks in our healthcare system, all of them now in long-term care, but there were also no new cases in residents or staff in the last 24 hours. So our total is 556 people in long-term care, including 340 residents and 216 staff who have been affected in that sector. We do have 2 new community outbreaks in office environments in the Fraser Health Region, one at New World Technologies and another at Maersk Company Distributing. These are very small, and once again, this is a testament to how people are being very careful and vigilant, and so these were detected early, and Fraser Health is working with the local businesses on site, actively investigating and ensuring that we prevent further transmission. We now have 207 active cases in the province. Of those, 31 people are in hospital and 8 now in critical care or ICU. And this, of course, reminds us that this can be a very devastating disease for some people, with the increase in number of people who need critical care right now. We have no new deaths in the last 24 hours, another important positive sign, and 2,229 people who have fully recovered. As we know, we are in our third week, the start of the second incubation period is how we think about it in recent days, and businesses have developed their plans and are slowly and thoughtfully reopening across our province. I think this is welcome news for all of us. We have seen many examples of business owners are getting creative, learning to operate safely and responsibly, and all of us are getting that comfort level with how we can do this in ways that minimize our risk to ourselves, our risk to the others around us, and our risk to our communities. It is okay to move slowly and at a pace that works for you, given your situation. Understandably, it makes some people a little bit anxious and a bit nervous, and for others, we're just not moving fast enough. But when it comes to businesses, having that posted plan, whether online, on your front door, is a clear indicator that that business has taken the time to be thoughtful and to work through and to do their homework on how we can all get through this together. It means we can visit a store, have a meal, enjoy a workout, and know that we have the confidence that we're all doing the right things to have our layers of protection in place. So these include things that we're getting used to, like incorporating barriers for safe physical distancing, one-way paths, employee training, making sure that we are able to maintain those safe distances as much as possible, and in those situations where we may be for short periods of time within other people's safe distance, using non-medical masks. These are all layers that we are using so that we can get our society and get our communities back and running again safely. Some businesses we've been talking through have been looking at where and how they can incorporate testing and screening for COVID-19, particularly for some of the businesses that are in more remote areas. We need to remember, however, testing does not replace the many steps that are required to keep everybody safe. Those steps that we know that we've learned over the last few months. Relying on one layer, like testing, is not enough and will not keep people safe on its own. Testing can help identify those who have COVID-19 so that people can rapidly isolate and that public health teams can start with our contact tracing and making sure that we're stopping those transmission chains. It's very important to understand that testing, however, right now can be unreliable, particularly for people who don't have symptoms or have very mild symptoms that they may not even recognize. Someone who is negative one day, who has an exposure, may actually be positive the next. The tests are not that great at picking this up early on. That's why testing alone does not insulate a business from needing to have a plan and for us all being able to take, being required to take those actions to prevent transmission. And that includes safe physical distancing, cleaning our hands regularly, putting up barriers, making sure that we're reducing our numbers in a space, and in some cases wearing a non-medical mask. A reliable test and accredited diagnostic facilities are also really, really important. And I know we've all been a little frustrated by how long it's taking for us to get a good, reliable test that can help us do things like understand who has antibodies in our community. And it is that risk of having both false positives and false negatives that is taking the time, and our BC CDC Public Health Lab, working with labs across the country, is ensuring that when we do roll out this testing, that we can be assured of accurate and reliable results. Coordination with local public health is also really important if you're thinking about a testing strategy, and local public health is here to support you in that. So I commend the many businesses who have worked really hard to put these necessary safety measures in place, and more of them are opening up this week. Your thoughtful planning is what will help us all stay safe and keep our curve flat as we're going through this next phase. And we need to continue to move slowly and to learn from one another. We also need to continue to show tolerance and compassion for each other, and to be patient, and to be kind and calm, and to stay safe.
Thank you very much, Dr. Henry. It's I think always a good day when we can announce there are no new deaths from COVID-19 in BC. That doesn't change the fact that we think about the families of 165 people who have died from COVID-19 and the significant impact of COVID-19 on all of their lives and on the lives of their communities and on their caregivers. So we think of them today even as we reflect on the relative good news of not being able to announce or not having to announce another person passing away. There are 31 people in hospital, as Dr. Henry has said. That's 16 in Fraser Health. That's 14 in Vancouver Coastal Health, and that's 1 on Vancouver Island. And there are no in hospital either at the Provincial Health Services Authority or in Northern Health or in Interior Health. And we have gone, though, and this shows the consequences of this virus, of COVID-19 in BC. We have gone from 5 people in critical care to 8 people. The other, I think, positive news today is that we're able to declare at 4 long-term care homes and 1 acute care setting, the Abbotsford Regional General Hospital, the end of outbreaks, which is good news for all of us. It means that there are 8 healthcare outbreaks ongoing in the province, 2 in Vancouver Coastal Health, 6 in Fraser Health, and that 1 of them in assisted living, 7 in long-term care at the moment. So that gives you a sense of that. And it also gives a sense, because of the new outbreaks at businesses, of the fact that COVID-19 is still there and still requires vigilance and all of the work that public health officials and communities are doing to keep it in check. One of the things that I wanted to just reflect upon today, I think it's important, is the ongoing work together of our health authorities across BC. We've been doing this, I'm just counting here, for 4 months and about 2 weeks or so since the first update. One of the reasons when our provincial structure of response to what was not then a pandemic, but in response, and was not then COVID-19 called that, but putting together a provincial response under the leadership of Dr. Henry, under the leadership of Deputy Minister Steve Brown, was the involvement of all the health authorities to ensure that the different needs of all the health authorities were addressed. They were all on the team, and that was critically important, including the First Nations Health Authority, the 5 regional health authorities, and the Provincial Health Authority, Health Services Authority. And we wish to thank all of them for their continuing efforts and all the efforts that will be required in the days and months to come. Today is Tuesday, and we'll be reporting on PPE today for June 2nd, as we have on the last number of Tuesdays. As you know, I have been reporting up to now on the PPE that's arrived since March, and here are those numbers just to remind you. Over 4 million N95 or equivalent respirators, which is significant. 76,000 of those are from the federal government's bulk procurement, or just under 2%. 4,500,000 surgical masks. 8,800 of those are from the federal government's procurement. That's just under 3%. 1,250,000 pieces of eye protection, including goggles and face shields. 381,696 of those, or 30%, are from the federal government's bulk procurement. 27 million pairs of gloves, 600,000 of those, just under 2%, from the federal government's bulk procurement. And 1.3 million gowns, of which 30,700, or just under 2%, are from the federal government's bulk procurement. Today I can tell you that since last Tuesday, we've received the following PPE in BC. 100,170 N95 or equivalent respirators, 728,150 surgical masks, 514,426 pieces of eye protection, 3,109,600 pairs of gloves, and 732,290 gowns. As I've said regularly, as we report on Tuesdays, we assess and test PPE and make sure it meets or exceeds safety requirements before it makes its way into the health system. And as announced last week, BC has sourced a leading filtration efficiency testing machine that will be used in the near future to test our PPE right here in BC. In the interim, until our testing lab is fully up and running, we've been working with UBC and other international accredited laboratories to have our non-traditional masks and respirators tested for both filtration efficiency and fluid resistance. Just last week, we received excellent news from two separate independent accredited laboratories that confirmed results that we had received from UBC testing. We learned that a respirator BC has procured from a new manufacturer in China has exceeded the National Institute for Occupational Safety and Health standards that Health Canada requires of the products we use in our health system. The new respirator has also passed fluid resistance testing conducted by independent laboratories and has had excellent results in terms of sample fit testing to confirm that the respirators seal the faces of a majority of healthcare workers. This is excellent news for two reasons. We have a significant inventory of this product, 3 million respirators in BC, and are now assured that the product is safe and effective for our healthcare workers. And the availability of this equivalent product will reduce our reliance on the traditional 3M respirators that have been extremely difficult to procure due to global demand and supply chain issues. We have not yet introduced these equivalent respirators for use in the health system, as we are taking the time in the coming days to communicate with healthcare workers about the new product, and very importantly, to make sure the respirators pass individual fit tests with every single employee that may need to wear them. The significant boost of 3 million N95 equivalent respirators puts us in good stead as we ramp up our health system, catch up on scheduled surgery volumes, and prepare our province for a potential second wave of COVID-19. While we're extremely pleased that we've successfully sourced a significant inventory of N95 equivalent respirators, the hard work of sourcing more surgical masks, gowns, and other important PPE continues. In BC, we've done this the right way. In a very uncertain and dynamic global market for PPE, we worked with supply chain experts to ensure we're dealing with credible and reliable suppliers. And we've established a robust assessment and testing protocol that is designed to ensure that PPE will be deemed safe by experts before it is worn will be deemed safe by experts before they are worn by our healthcare workers. With the news many are hearing about PPE quality or counterfeiting in other jurisdictions, I know that healthcare workers and the public have concerns about the safety and effectiveness of PPE. The Ministry will be posting its PPE assessment and testing protocol later this week as part of its update to the BC's PPE framework. I encourage anyone with concerns about the quality of PPE used in BC's health system or with questions about how BC is managing its PPE inventory to look at that document, which will be posted by Friday of this week. Our success in sourcing safe and effective PPE in BC is something to be proud of, and I'm proud especially of the people of the Provincial Health Services Authority and Vancouver Coastal Health and other health authorities and in the Ministry of Health for all of their work. This success was not based on luck. Thanks to our healthcare workers that have worked hard to conserve our PPE inventories, the supply chain and the logistics teams at the Provincial Health Services Authorities and regional health authorities for their navigation of an unprecedented global market for PPE and for their coordinated provincial approach. The occupational safety and health teams across health systems that work every day to ensure healthcare workers are protected and know how to safely use their PPE. We'll continue to source the PPE we need in BC, and I'll continue to keep the public updated on our PPE situation going forward. I wanted to say just a few words in French, and then we'll take your questions. Aujourd'hui, nous annonçons 4 nouveaux cas pour un total de 2661 cas de COVID-19 en Colombie-Britannique. Nous sommes heureux d'annoncer qu'il n'y a aucun nouveau décès lié au COVID-19 hier, mais il y avait eu 65 décès en Colombie-Britannique et nous offrons et nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches. Chaque régie de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 904 se trouvent à Vancouver Coastal, 1311 à Fraser, 127 sur l'île de Vancouver, 195 dans l'intérieur et 64 au nord. Parmi l'ensemble des cas confirmés de COVID-19, 31 personnes sont actuellement hospitalisées, dont 8 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
To everybody on the phone, please press *1 to enter the queue. You are limited to one question only. I would also ask that you please take your phones off mute. You will not be audible until I call your name. First question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Is there any chance that school will return to full-time classroom instruction in September if numbers are good, or should parents prepare for this hybrid part-time school model that was introduced yesterday to continue when schools reopen in September? And if that's the case, what will have to happen before you'll approve a full normal return to school?
Yeah. So I think the Premier made a comment the other day about how, thinking of September is like thinking of dog years away. So we don't know what's going to happen between now and then. And I expect that there'll be very likely going to be a hybrid model, but I think it will be different than what we're seeing right now. That's one of the reasons why going back to school and having some in-classroom learning right now was so important. It was helping us understand how we could actually do this, and in a sense where it's voluntary and small numbers, and to get us used to the concept of how we can have a hybrid. But I fully expect all children will be back in some sort of a classroom environment come September, and it is really important. There's good evidence that shows that particularly for some children, having that in-classroom learning environment is incredibly important. And we know, that some children who are falling behind will never make it up, and how important it is to support those children and families who need it at this point in time. And that's one of the reasons why we felt so strongly about the need to have some ability to support those children at this point, and to make sure that we were able to look at the logistics of it instead of having people wonder through the whole summer if this was going to work. So we've put a lot of thought into it, and I think here it's going well. Small numbers of children, which is just fine. We will get comfortable with this, and we'll look at how to do it better through the summer. So I can't say for sure, but I suspect we will have, we'll likely have more in classroom, absolutely, but there will need to be some sort of a hybrid, and we'll also need to have those provisions in place for if we start to see cases arise in the community, in the school community, and we will have our public health processes to support the school communities through that as well.
Next question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. Thanks for taking my question. On Saturday, you talked about why it is taking longer to validate a serology test here in Canada and in BC, and you described the reasons why it's been so challenging. I was just wondering, as a follow-up, has the amount of time it's taken to do this longer than you expected, has that had any impact on your various planning for phase 2, phase 3, for contact tracing going forward? Has it thrown off the schedule you were hoping for on all that?
Not really. There's some aspects that I would have liked to have more information on that serology testing would help us with, and I'll get back to that in a sec. And I think there's some uses of serology testing for investigation of outbreaks that we've not yet been able to incorporate into our public health processes. But I will be talking a bit more on Thursday with some numbers around the case investigations and the contacts and how we do that. And we are ramping up our capacity for the diagnostic testing that we're using, the NAT testing. And that is really the important thing for this point in terms of diagnosing people and catching them early in the community right now. So where serology testing would have helped, where I would have liked to have had more data from serology testing is there was a period of time, particularly in March, where, as you will recall, where our capacity was exceeded, and we were concerned about testing in the community, and we focused the testing on where it would impact our healthcare system, particularly for people who were coming back from other countries where it was very challenging with large numbers, and most people with mild illness could be managed at home. And during that period of time where we were expanding our capacity, the capacity was also less in the north, the interior, and Vancouver Island. So we have a number of cases that we call epidemiologically linked cases. And I've talked about this before some weeks ago, but people probably don't remember. But these are people who may have been in the family of somebody, for example, who tested positive, and they had a compatible illness and they were able to be managed at home, didn't get that sick, and we would call them a case, even though we didn't have a lab test. And it may be because it would take too long, or we didn't want them to leave the home while they were sick during that period of time when we didn't have as much access. So there is some of the health authorities that had that less access have kept track of those people. At some point, those are people we would like to test with the serology test to see if they have antibodies and to see, whether we can include them as true cases or not. So I think that's one of the things. We'd also like to be able to have a better understanding of the impact on the community. So how many people do have immunity? And I don't think, but it's not, I do not expect that it would be at a level that would give us any change to how we would look at rolling out the restart program that we have. So from a epidemiologist point of view, there's a lot of things I would have liked to have more information on, but we have the tests that we have, and we have the capacity to understand transmission in our community, and those are the main things that we need right now.
Tanya Fletcher, CBC.
Hi, Dr. Henry and Minister Dix. We're hearing from the parents of a 13-year-old from Saskatchewan who has scoliosis. Her urgent surgery in BC was postponed, and the surgeon has recently told them they can't be rebooked because she is from out of province and there is a COVID concern. Her spine is now curved 57 degrees. If she doesn't get the surgery before it hits 65 degrees, she's out of luck. So what can you say to this family who's desperate for her to get the surgery?
I will say that I have been inundated with people's personal stories like this, and there is a process, and I feel for every single one of them. But they need to continue to work with us. There is a strategy for the restart of the surgeries. There's a strategy for people coming from other provinces for needed surgeries that they can't get. And there's a strategy for people from BC who need to have surgeries in other places. Some of those have been delayed. Some of it has to do with the capacity here. Some of it has to do with the capacity. I know a number of people were booked for surgeries in Montreal where they are not yet at the point where they've opened up those surgeries. So these are all very complex things on an individual basis that we are working through with individual families. And then,
I mean, as I think you know, Tanya, we're not going to be able to talk about the individual case here. I would say that we're significantly ramping up the surgical process, and if people have concerns, there are ways, both through the Patient Care Quality Council and directly with health authorities and doctors, to address individual issues. So I'd recommend people do that. We're thinking of everyone, because the consequences of cancellation of scheduled surgeries, or the delay at least of scheduled surgeries in BC, have been profound for lots of people. And obviously we look at each case and each person as an individual. I think last week we had contacted I think in the neighborhood of 18 or 19,000 people who had had their surgeries delayed, and had individual conversations with them and have been booking surgeries. So I'm sure health authorities would look at these individual cases, but I don't really think this is quite the medium to which we can do that. We need all the information. We need the appropriate people who deal and make those decisions and work with families to deal with that.
Next question is from Megan Turcotto, Global Okanagan.
Hey, so I just noticed on the BC CDC dashboard yesterday that the number of new tests in the interior were listed as 10, and that's a lot lower than what we typically see. Often there's hundreds of new tests each day. Just wondering how you feel that the testing is going, particularly in cases like the interior where we have fewer cases, if you feel that enough people are coming forward for testing.
Yeah, I'm not sure if that was might have been a typographical error, but we can check that. I know that the testing has been going. We've been around 2,000, 2,500 people per day across the province who have been tested, and it may also be a delay. Sometimes if there's a problem in getting a sample to the lab, etc., that there may be a delay in certain things. So I have been confident that we are testing very widely and that the access to tests are there, and the turnaround time is less than 24 hours now. So, the processes that we have in place are going well. I hear from my colleagues in the field that they are able to test people who need it, and that anybody with symptoms in the province can get the test when they need it. I will also say you've reminded me of something in the dashboard last night. There was an additional death that was put into the numbers in error. It was a data reconciliation mistake as well. So sometimes those numbers may be off by a little bit.
Next question is from Lisa Eusda, News 1130.
Hi, Dr. Henry. With the serology tests, I know they're weeks, 2 weeks, you're not quite sure when they're going to be available, but when they are, what is the priority? What is going to be the process for who gets tested when, how it's done? And is it going to be like a blood test that has to go through a lab, or is it like a diabetes test or a pregnancy test where you can just do it where you are?
So there's several different ones. Some of them are tests that require a blood draw. Some of them are finger prick tests that you put on a little cassette and you can mail it in, but it needs to be done in the lab. And some of them are what we call those flow tests, which are like the pregnancy test, which could potentially be done, as we call it, at point of care. All of those are being investigated right now, and the priorities, there's a couple of things. There is I keep forgetting, Federal Immunity Task Force that has been established, and a number of our brightest scientists from BC are part of that, including Dr. Mel Krasden from the BC CDC lab, Dr. Deb Money from UBC and Women's Hospital, and Dr. Gina Ogilvie, who's also at UBC and Women's Hospital, and they're all part of it. And it is looking at how we can understand serology for Canada, and they're connected, of course, internationally as well. So there's 4 different areas that they're looking at. One of them, of course, is validating tests. One of them is understanding what antibodies actually mean. So as we've talked about before and around the world, we're still trying to figure out, is there a specific level that you need to have? For example, we know for measles, if you have a level above a certain amount, then you're considered immune. We don't know what that number is for COVID-19. We don't know how long immunity lasts. We don't know if you have a mild illness, do you develop enough antibodies to protect you from infection again? So one of the other things we're looking at, so that's sort of the basic science part of trying to understand the antibodies. The other part of it that we're focusing on is, okay, who do we test? Some of the priorities we will have are determining those people who were epi-linked, who we think had this, and people who have identified as having a COVID-compatible illness during the previous few months. For example, from our survey that we sent out. Those will be a priority for one part of it. We also have a research project that we have funded early on in this, and we have serology samples, 1,000 from different age group of people from the community in BC. The first tranche of these samples was taken in early March, and the second tranche is coming out this week, and so those will be a priority as well. So those are random samples of blood that we are using to see what the baseline might be in the community. There's also a number of national studies that we're looking at and partnering with other provinces to try and understand the community level of antibodies as well. So all of those are, I would encourage you to go to the Immunity Task Force website that the Public Health Agency of Canada's put up, and they have these outlined quite a bit, and BC is partaking in many of them.
Prishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. According to BC CDC data, there's been one active case of COVID-19 in the Island Health region for several weeks now, and the dashboard says the individual is still in ICU. Can you provide an update on this particular case and how the person is doing?
They're stable, but this once one is in ICU, it can be a long road to recovery, and so clearly they're not at the point where they're stable enough to be back into a hospital bed or be discharged. We've heard the stories, and more of them are coming out. We'll talk a little bit more about this on Thursday when we talk about age and the impact of this virus. But we know even very young people who are able to recover at home can sometimes get very ill with this, and it wipes people out for a long time. It's more than just the common cold. It's a very severe, as much of influenza can be, and we know that people can have, it can be a very prolonged recovery period. So as far as I'm aware, that person is still stable but still in critical care. And yes, the good news is that we have had very few cases here, even though we've been doing quite a lot of testing in the Vancouver Island region.
Graham Woods, Glacier Media.
Hi there. I'm just curious about a proposal from Andrew Wilkinson to open up regions, look at regional openings, whether they be hot zones or cold zones for COVID-19. Can you speak to that?
Yeah, I think one of the things, I believe that one of the things that has allowed us to manage this pandemic in the way we have and to keep our overall numbers low is because we've had a coordinated provincial approach. And we have seen the numbers decrease as the testing capacity increases, as the public health teams are doing their work, as our businesses are opening and changing around the province in sync. And I don't feel that there's a differential risk right now. We are having low levels of transmission in parts of the province. We've had a couple new cases in the north, a couple new cases in the interior. But where the population is where we're seeing most of it. So at this point, this approach has really served us well. And I think we should have a continued approach unless there's good evidence that there's a reason not to. That would be my opinion. I haven't seen the letter from Mr. Wilkinson.
Just to say that we continue to appreciate and I think have a very good relationship with the parties in the legislature. It's absolutely reasonable to make suggestions. One of the things I'd say, though, about BC is what I was saying, I think, during my presentation, which is that one of the reasons we've been successful in BC is that all of the health authorities have worked together, including Provincial Health Services, including the First Nations Health Authority, and all of the different health regions. Well, they've all had different challenges. We've put in place very significant changes to support transportation to small communities, to rural, to remote, to Indigenous communities in the province. All of them have had somewhat different demands and challenges. Everyone has worked together to date. And this reflects, I think, something basic about the BC health system that Mr. Wilkinson and others will note, maybe even celebrate, which is that we have 5 regional health authorities. We have the Provincial Health Services Authority. We have the First Nations Health Authority, which gives us, I think, an advantage at the moment against other jurisdictions that have many, many, many more health jurisdictions, individual hospital boards, and so on. It's given us an advantage to coordinating and to have a one province, a single province approach. And so I think the approach that we're taking, which is to continue to view it in that way in this phase 2 period and phase 3 period, is the right period. But certainly the questions that are posed by Mr. Wilkinson and their team are reasonable questions. But I think our approach has been the right approach. It's the one that has yielded the best results, and it recognizes the potential risk in all health regions, and that, in fact, some of the health regions that have had the lowest outbreak have also had very significant cases and very unique circumstances that have required a remarkable public health response. And I can think of 1 or 2 in particular. I know the people out there will be able to identify their own. So, in short, I think our BC approach to this, which has supported every health region, which has responded to this in every health region, which tests in every health region and gives resources in every health region and has a similar response across jurisdictions, is probably the right approach for BC. But certainly it is true that that we've had fewer cases. Really, the farther you get away from the I-5 corridor here, we've had fewer cases. That's a fact. We've had more cases in Metro Vancouver. That's a fact. But it continues to be an issue in every part of the province. And I think continuing this approach with Dr. Henry and Stephen Brown leading the provincial response, with all of the health authorities responding, and with maintaining a level of care that deals with the concerns of all the health authorities at a high level, I think that's the right approach.
Next question is from Sandy Hall, CFAX 1070.
Yeah, hi, I hope you can answer this. We're noticing there's been one case in ICU here on the island for a significant period of time, and I'm wondering if you can elaborate on whether it's the same person or if we just keep seeing another person keeping that number to one. It just seems like an awfully long time for somebody to be in ICU.
Yeah, I actually, as I just said, this person, I believe it's the same person that has been in ICU for a period of weeks, but I can check on that and provide details.
Great. Next question is from Jane Side, North Shore News.
Yeah, hi. I'm not sure if this question would be directed at Dr. Henry or at Minister Dix. I've been hearing some stories from patients who are waiting for orthopedic surgery at Lionsgate Hospital, and they've apparently been told that they are going to have a extremely long wait for their surgery because the amount of operating room time available for that particular type of surgery at Lionsgate has been cut significantly, and that's compared to what's being offered at other hospitals, and also compared to other types of surgery at Lionsgate. That's what they're being told in a letter from their surgeons anyway. And I'm wondering if anybody can explain what's going on there and why.
Yeah, I was aware of some of this complaints from certain surgeons, and that's, as you know, we have a surgery restart strategy that's posted that Michael Marchbank was leading, along with all of broad consultation. So that really is an issue that needs to be taken up with the regional health authority, so Vancouver Coastal Health, and ensuring that everybody is aligned. The processes, I know, were gone through in detail for different types of surgeries, and there's a balancing process between the types of surgeries that may require things like ICU care, and you have to balance that out with the need to protect some of those resources in case we have a resurgence or an outbreak. So I know there's a lot of very detailed considerations that went into the restart of the surgery planning, everything from PPE to where outbreaks were to how to make sure that we still had the capacity to respond and have surge capacity if we needed it. So it's not something that was done lightly, and I don't know the details of that particular surgery or why the concerns were expressed, but that is something that should be taken up with Vancouver Coastal Health. And again, there is the Patient Safety Quality Office that is available for people to put their own concerns forward and have them dealt with on an individual basis.
So, Jane, as you know, with hip and knee replacement surgery, orthopedic surgery in general, we dramatically increased resources in recent years. So we went from about 14,250 surgeries in 2016-17 as a baseline to, in the 2018-19 year, I think it was close to 19,000 surgeries, which is an extraordinary increase in a couple of years. As we restart surgeries, priorities are slightly different in the initial period. We have to continue to deal with urgent surgeries and the most urgent surgeries that are before us now. And I'll be reporting on some of these questions, including the one you asked tomorrow. But I would say that what we're attempting to do is dramatically ramp up our level of surgery that we're going to need 5-6 months from now to start to reduce the people who are not the people who had their surgeries delayed, but rather people who would have had their surgeries in the natural process. So we're going to do all of those surgeries that we were going to do. We've got to make up the ones that we missed out on, and that's what's going on now. But that process is going to be led by health authorities. It's going to be driven by the priority of patient need. And hip and knee replacement surgeries continues to be a high priority, and we're going to start, I think, to move to those as we go through the surgery renewal plan. But this is really the most ambitious surgery plan anywhere in the country, and the most ambitious surgery plan we've ever tried in BC. And by about June the 15th, we should be back to about 100% capacity. Then we have to deal with the most urgent surgeries that may have become urgent in that time. And then we've got to start reducing those lists again, and that's going to take some time. The increasing of capacity, that's going to happen over the next 5 or 6 months as we hire more people and increase the amount of capacity, but we should be back to 100% of surgery work by the middle of this month, and we should be right at capacity of our non-hospital surgeries in clinics and private clinics and so on that have public contracts under the Medicare Protection Act and the Canada Health Act now. So this is what's happening, and we're going through it. It's being driven by medical need to begin with, but the priority of hip and knee, the priority of dental surgery, which is another key priority of the plan dating back 2 or 3 years, you're going to see that in the course of this year.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Dirk Meisner, Canadian Press.
Hi, Minister Dix. Can you, or with your report today on the supply of PPEs, can you elaborate a bit more on why today it's almost a day of celebration that we've got enough surgical masks that actually work?
Okay.
So I don't think I fully understand that question, but let me give it a try. Dirk, and I don't mean facetious. I think what we announced today was that this is how we're doing it in BC. That when we use non-traditional suppliers, we extensively test those new supplies. Now, of course, once they've been approved and they've gone through the process, we can have confidence in them. But to do that, to have people in our system use PPE, requires it to meet the test for British Columbia. And that's why we've been systematic. We've reached out and acquired a very significant amount of PPE from N95 respirators or equivalent to others. And then we've systematically gone through working with our employees, testing the product to make sure it meets our standard. And we should do that, surely, before we have anyone wear it. So I think it is a good day that the PPE, especially in one area, the respirators that we've acquired, have met that test and indeed exceeded the standard. I think that's good news, and that's the report we're doing. And what we've said on PPE from the beginning was that we report on the challenges. We report week to week on where we stood, on what we'd acquired and what we hadn't acquired, what the federal government had acquired in their efforts to assist provincial governments with PPE. And I think we did that today. And I think it is very good news, because what it says is that all of the people working together in the healthcare system in the most difficult of times have come through this and are coming through this, and we're now having a very significant new supply of some PPE coming in the market that people can have confidence in because it's been tested and we're going to work with people on. And that's how you prepare not just for now but for the future in terms of PPE, because we don't know how long the global supply chains are going to be interrupted. So we have to go out and can't depend on anyone else, can't depend on the federal government, can't depend on our traditional suppliers. We've had to depend on ourselves, and I'm very proud of the people who've worked on it. And what you're seeing, what you're talking about in terms of celebration, is a systematic, serious, scientific approach to a significant problem that beset every health system in the world. And I'm really proud of our team. And the other part that was critical about PPE was the inclusion in our supply chain early. And this was part of the Team BC approach we took to long-term care that included providers who public beds and private facilities, and included health authority owned and operated beds, where we included long-term care homes. We didn't in our supply chain. I think that made a lot of sense, and I think that gave great support to long-term care homes, and that was a decision that other jurisdictions made, but they made later. And I think our approach to PPE, driven by unbelievable dedication from public servants and from health authority officials, has been a good approach. So today is a good day, but this is a problem we're going to have to work on every day going forward in a global market for PPE that has been so fundamentally disrupted. We've got to continue to do our work, and as you would know as well, we have to continue nationally to increase domestic manufacturing of PPE so that our long-term security is in a better position in the coming years. Thank you very much. Merci beaucoup.
Thank you.